to this ASN Kidney 360 podcast. I am Maggie Hahn, a research scientist at the Renal Research Institute. Today, I'll be discussing our study published in Kidney 360 titled Dialysis-Imposed Patterns of Nocturnal Sleep Duration, a multi-center prospective study in patients using a wearable activity tracker. What are the aims and methods of the study? It is well known that many dialysis patients experience poor sleep. We aim to measure objective nocturnal sleep duration of patients on hemodialysis and characterize natural and dialysis-imposed patterns of sleep duration using a commercially available wearable activity tracker. Participants were followed with the Fitbit Charge 2 activity tracker for up to 1 year, and nocturnal sleep data was recorded continuously if the patient was wearing the device. Sleep duration was assessed according to dialysis start time, with patients who had a median dialysis start time before 8 a.m. being categorized as early starters and those after 8 a.m. as late starters. Dialysis versus interdialytic days, with interdialytic days separated into the post-dialysis day and second interdialytic day, the days of the week, and seasons. Clinical, laboratory, and hemodialysis treatment data were extracted from the electronic medical records. Linear mixed effect models were constructed to determine the effect of the various time patterns and predictors of nocturnal sleep duration. 109 patients contributing 14,190 patient days of data were included in our study. The average age of our study cohort was 54 years old, and the majority of them were male, and just a little over a fifth of the participants were diabetic. The average nocturnal sleep duration was 276 minutes or 4.6 hours per day. 94% of patients slept less than the recommended 7 hours per day. Patients slept almost an hour less on dialysis days compared to the post-dialysis and second interdialytic days. Early starters slept on average 40 minutes less per night compared to late starters. Furthermore, early starters slept almost 1.5 hours less compared to late starters on dialysis days. When looking at sleep over the days of the week, we observed that participants slept on average half an hour longer on Sundays compared to the other days of the week. This Sunday effect on sleep was observed in both patients on Monday, Wednesday, Friday, and Tuesday, Thursday, Saturday dialysis schedule. In multivariate analysis, higher systolic blood pressure and higher serum creatinine was significantly associated with shorter nocturnal sleep duration. What are the limitations of this study? Firstly, we were only able to analyze nocturnal sleep data if the participant wore their wearable activity tracker. This may have introduced bias to our study results. Second, we were only able to measure nocturnal sleep duration and did not consider daytime napping. This exclusion of daytime napping may have led to an underestimation of total sleep duration. Furthermore, our study population is younger than the typical dialysis patient. It is known that people tend to sleep less as they age, and thus the nocturnal sleep duration in our population may not be reflective of that of the general dialysis population. Lastly, the participants in our study were required to maintain the use of the wearable activity tracker on their own. This means that our population may have greater technology literacy than the typical dialysis patient. How can the results of this study be used to change clinical practice or service provision? From the findings of the study, it is obvious that patients on hemodialysis do not sleep enough. Dialysis timing plays a major role in nocturnal sleep duration, with the early morning shift being associated with significantly decreased sleep duration on the day of the week. Patients on dialysis also sleep longer on Sundays compared to the other days of the week, irrespective of the dialysis schedule. Insight into nocturnal sleep duration in respect to different timescales may allow healthcare providers to make more personalized recommendations to improve the vital function of sleep and aid in the shared decision-making process. Sleep plays a vital role in health and patients receiving chronic hemodialysis, and these patients do not sleep well. Further studies utilizing the objective measures of sleep over a long follow-up period is required to acquire further insights into how sleep behaviors change over time. These insights will then in turn allow for more targeted interventions to improve sleep in this population. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.